This is the Dusk Pillbox Hill Medical SAMS Equipment Handbook. This video serves as a comprehensive guide for all medical staff. Welcome to the Dusk Pillbox Medical Handbook. We will discuss medical equipment, its function, and how to use it. This information must be common knowledge for all Pillbox medical staff. The intravenous or IV kit is used for fluid and medication delivery directly through the bloodstream. It's the fastest way to administer treatment. Note that it is susceptible to freezing in cold temperatures. In this section, we will discuss breathing and oxygenation aids, covering their purpose, when to use them, and any related precautions. The airway suction device clears fluids from the airways using suction. Use this when you suspect a patient's air passage is blocked. Suctioning should be done in 10 to 15 second increments, never constantly. A bag valve mask, or BVM, delivers rescue breaths for non-breathing patients and has an oxygen inlet. There are no specific precautions listed for this device. The nasal cannula is used for oxygen therapy during blood loss, smoke inhalation, shock, and thorax trauma. It is comfortable for the patient, but less efficient for oxygenation. The nasopharyngeal tube, or NPA, is an alternate airway for patients with severe trauma to the mouth area. It is not comfortable, so ensure the severity warrants its use. The non-invasive ventilator is located in the back of the ambulance and assists patients who are not breathing on their own. The patient's airways must be clear for this to be effective. The non-rebreather mask, or NRB, is used for oxygen therapy during blood loss, smoke inhalation, shock, and thorax trauma. There are no specific precautions listed for this mask. The oxygen tank with regulator provides enriched oxygen flow for oxygenation during trauma. A critical precaution is that oxygen is highly flammable, so tanks must be kept clear of fire hazards. The oropharyngeal airway, or OPA, is an oral airway utilized to maintain an open passage that might be swollen shut. Use this when intubation is unavailable. This section covers wound dressings and bleeding control. We will discuss their purpose, appropriate usage, and precautions for patient care. The burn dressing is a protective cover for burns with a gel coating on one side. There are no specific precautions listed for this dressing. Hemostatic dressing is Z-fold gauze treated with a hemostatic agent used for severe hemorrhaging. Only use it for severe bleeds not controlled by standard dressings, as removal can be difficult. The multi-trauma dressing is thick and highly absorbent, often used with gauze for further bleeding control and maintaining pressure. No specific precautions are listed. An occlusive dressing is a water and airtight seal with one-way venting, primarily used for puncture wounds to the chest cavity. Use it only for wounds suspected of taking in air to avoid complications like tension hemothorax. Standard gauze dressing is an absorbent material for open wounds, providing minor bleeding control. Do not use it on burns or for severe bleeding control. A tourniquet is used to stop severe hemorrhage in the extremities by restricting blood flow. Use it only for severe bleeding, such as arterial bleeds, due to the limited time before lasting damage occurs. Next, we will review cardio equipment, focusing on its purpose, appropriate use, and necessary precautions for patients. The automated external defibrillator, or AED, is used during sudden cardiac arrest. Clear the patient before delivering a shock. Always follow immediately with chest compressions to help restart a proper heart rhythm. The electrocardiogram, or ECG/EKG, records cardiac electrical activity to monitor heart rhythms for irregularities or sudden changes. There are no specific precautions listed. The Lund University Cardiopulmonary Assist System, or LUCAS, delivers automated chest compressions, typically during transport. Ensure the patient and LUCAS are connected to an EKG for proper operation. This section covers advanced life support equipment. Remember, this equipment is only for ALS-certified paramedics. The Air Release System, or ARS, is a needle decompression kit for tension pneumothorax. A critical precaution is that only ALS-certified paramedics are cleared to use this equipment. The EZ-IO kit is used when standard IV delivery of fluids or medications fails. Only ALS-certified paramedics are cleared to use this equipment. The intubation kit is utilized when a patient's airways are compromised. Only ALS-certified paramedics are cleared to use this equipment. In this section, we will discuss injuries and the required items for treatment. While the triaging system is a good starting point, do not rely on it entirely to determine injuries. To treat animal bites and scratches, you will need an antiseptic wipe, gauze, an antibiotic shot, and a bandage. To treat bruising, you will need ice packs and bandages. The type of bandage depends on the severity of the bruise. Gunshot wounds require gauze, an antiseptic wipe, tweezers, a suture kit, and a bandage. Stabilize the patient on scene and transport them to the hospital for further treatment. Minor bleeding is one of the easiest injuries to treat, requiring only a simple Band-Aid. For moderate, significant, or extreme bleeding, you must determine the severity and decide which bandages are necessary for treatment. To treat a stab wound, you will need an antiseptic wipe, gauze, a suture kit, and bandages. Stabilize the patient on scene and transport them for further treatment. Taser prong wounds require antiseptic wipes, tweezers, gauze, and bandages for treatment. When treating patients, always use your best judgment. Maintain a calm and rational thought process, even in high-stress situations. Your community needs you. Welcome to the Pillbox Hill Medical Team.